Good evening, everybody. We're going to give folks just a few minutes to get on the webinar, and we'll start shortly. And welcome, everyone. We are going to give folks just another minute to get on the webinar, and then we will begin. All right, thank you all for joining us tonight. We're going to go ahead and get started. Tonight, we're presenting a webinar on ensuring racial equity during COVID-19 and beyond. Tonight's webinar is hosted by Jessica Howard, our Community Education Manager. Jessica has been at the ACLU of Colorado for probably 7 years now. I think I'm making that up, but anyways, more. But prior to being the community education manager, she was the affiliate's paralegal. In her role as the education manager, she oversees the development and implementation of public education programs, including Know Your Rights training workshops. She is passionate about disability rights advocate, having served on the Colorado Development Disabilities Council, Denver Public Schools Special Education Advisory Council, and Disability Law Colorado's Protection and Advocacy System for Individuals with Mental Illness. She holds a bachelor's degree in political science from the University of Colorado, paralegal certificate from Community College of Aurora, and her interests include photography, hiking, and trying new foods. We are very honored tonight to have a special guest, Representative Leslie Herod, who was elected in 2016 as the first LGBTQ African American in the General Assembly. Since her election, Representative Harrod has sent 52 bills to the governor's desk, marshaling through numerous pieces of legislation addressing criminal justice reform, mental health, and substance abuse, renewable energy, youth homelessness, and civil rights protections. Some of her signature work includes, and we love this one at the ACLU, reauthorizing the Colorado Civil Rights Division despite enormous pressure to weaken it, ending cash bail for minor offenses, another one we love, defelonizing drug possession, giving every child born or adopted in Colorado a $100 college Kickstarter account, and providing free menstrual hygiene products to inmates in Colorado prisons and jails. In addition to winning re-election in 2018, Rep. Harrod championed a ballot initiative, Caring for Denver, that will raise $35 million annually for mental health and substance abuse treatment and services for children and adults in Denver. And that initiative passed overwhelmingly in Denver. She serves as the chair of the House Finance Committee, vice chair of the House Judiciary Committee, chair of the Committee on Legal Services, and chair of the Colorado Black Democratic Legislative Caucus. So I'm going to hand it over to Jessica, and thank you again for joining us. Thanks again to Rep. Harrod for joining us.
Thank you so much, Delana, for those wonderful introductions. Thank you, everyone. Again, my name is Jessica Howard, and Representative Harrod, thank you so much for joining us tonight on such an important issue that has been cropping up that, we certainly would, want to take some time to address here tonight. So as we're sitting in our homes, receiving news about, how COVID-19 is impacting our lives, of course, we come across the startling and disturbing fact, and that is the numbers of COVID-19 rates of infection and death is a pattern where people of color are seeing higher rates than their share of the population. And that public health experts and officials are quick to note that, long-standing societal, economic, and health disparities are among the reasons that the coronavirus is affecting people at higher rates. But when we think about, what do we mean by, the reasons behind coronavirus being, long, societal, economic disparities, like what do we mean by long-standing? So, of course, for many folks in Black and Brown communities, when this disease hit, it wasn't a matter of if people of color were going to be disproportionately impacted by coronavirus, but more of when these disparities were going to unveil themselves in more prominent ways. And that is what we'll be discussing here tonight in tonight's webinar. So for tonight, our overview is that we're going to discuss how these systems, these systemic systems of redlining, incarceration, and healthcare play a role in racial and ethnic outcomes, as well as review how racial and ethnic disparities are playing out in the COVID-19 cases and deaths that we're seeing in data in Colorado and nationwide, followed by action steps to talk about that Representative Harrod will be discussing to ensure a more anti-racist, equitable approach to the COVID-19 response. And then a few resources at the end and some information about COVID-19 that we hope will be helpful for low-income communities and communities of color. So in every webinar, since I do a lot of Know Your Rights trainings, I always, want to start off that this is a webinar and it is intended to be a resource. We're not attorneys, and so we'll not be providing legal advice because we know that each situation or case is different from one another based off of the facts. And so for purposes of that, and also we're not attorneys. So let's go ahead and get started. So Before we take a deep dive into what's happening to our communities of color in Colorado and across the country, it's important to lay the groundwork for how we got here in the first place. So we're going to give a historical context of how social systems play a role in our livelihoods. This is where kind of my dad would like tell me all the time, you know, let's sit down for a little history lesson. So that is what we're going to do here. So health disparities that are experienced by communities of color, and particularly Black communities, do not just come out of thin air. They're coming from a place because, as we know, race is a racial, it's a social construct. It's not biological difference. So instead, we see these disparities proliferate due to external factors that are driven by systemic racism. So what do we mean by that? So for example, when there are social decisions such as de jure segregation laws like Jim Crow, in discriminatory housing practices, such as redlining, to determine whether, you know, where Black and Brown communities have historically been permitted or now can afford to live. These decisions also determine where industrial companies get to dump their toxic waste and where that gets cited, which is the stuff that is linked to asthma and more lung disease conditions, where a neighborhood is deemed worthy to obtain a grocery store that carries fresh food, which can make a difference in terms of outcomes of diabetes, heart disease, and obesity. Black communities and communities of color are going to disproportionately experience these conditions that are brought on by these environmental factors, and therefore bring about more conditions, underlying conditions that may make communities more susceptible for events like a pandemic. Another external factor that can impact health outcomes is the structural racism that plays out in mass incarceration. We see the over-policing of communities of color leading to overrepresentation in our crowded jails and prisons. People are held in cages pre-trial because they cannot afford the bail money for their release from jail. As many of you guys may know, that the ACLU of Colorado and its coalition partners have been working really hard during this pandemic and making a big push for decarceration of our jails and our prisons, because we know that the spread of COVID-19 and the very nature of these detention facilities to pack as many people in one space makes it a prime hotspot for this disease to proliferate. The other thing that we have to look at is healthcare infrastructure. As we'll be mentioning throughout the webinar, biases and stereotypes that we believe about certain communities is something that we carry with us everywhere, including into our professions. So this, unfortunately, also includes healthcare professionals. We have seen time and time again that racialized healthcare can play out in determining whether or not symptoms a person experiences is related to pain, or if we just think that they're another drug addict and trying to get a prescription, or believing that underlying conditions like diabetes and heart disease is just due to laziness and not whether or not that person has available fresh food to make a healthy meal. And of course, we cannot, you know, talk about the historical factors driving health disparities unless we hold space for the historical mistreatment of communities of color, particularly our Black and Indigenous communities in this country. You could put an entire webinar, this would be an entire webinar on its own, with libraries kind of filled with stories and documentation from experimentation on enslaved women for the advancement of modern gynecology, to withholding medication to treat syphilis, just to see what could happen when the disease goes unchecked, all the way to forced sterilization of Black women just within the past 40 to 50 years. And, certainly there is a lot of history that you can look at, particularly with Black communities, but this affects many communities of color. If we even just look at Indigenous and Native communities, this is exacerbated, where we're seeing rates of infection and death among Native Americans to be at disproportionate rates. What we know in the back is they too are communities that, based on environmental factors of not having running water, about 13% of Indigenous homes lack safe drinking water and proper wastewater disposal, which would impact the way you're able to wash your hands. This all kind of plays a role. Also, being able to have access to fresh food ends up leading to bring on higher rates of diabetes, heart disease, hypertension, and so forth. And so, looking at that, what we could put it this way: when you have systemic racism play out to determine where Black people and communities of color get to live, whether that be in or outside of a cage, how these environments negatively impact their health will likely attribute to poor health outcomes. And that if you have these poor health outcomes and you try to go to a hospital to seek care from an infrastructure or a system that may have implicit biases, not only about you as a member of a community, but also biases about why you have those pre-existing health conditions, you're not going to get the same level of care of, say, like your white colleagues. And you're going to remember that. You're going to remember not getting that same level of care. And that can sometimes even further entrench some of those reasons of distrust in the healthcare system that has been well documented because of the histories that we've seen in terms of mistreatment for you and your community. And you're probably, I have experienced, will likely sometimes avoid going to the doctor at times to just avoid that similar encounter. But if you have those health conditions and they go left unchecked, they can also exacerbate into further poor health outcomes, or even worse, if you're in an economic situation such as not making enough money as an essential worker to cover health insurance costs, it becomes prohibitive. And now maintaining your health becomes a privilege. And so the cycle continues. And so with that, we want to take kind of a national look as to what is happening with COVID cases that we're seeing. Knowing, now that we've laid the groundwork of the history of racial disparities and health outcomes due to some of these environmental factors, what we see is Black, Brown, and Indigenous communities are disproportionately contracting and dying of COVID-19, and that these deep-seated inequities are having a disproportionate effect, like lack of also having it's having a disproportionate, what I'm basically saying is having a disproportionate effect. So before the pandemic, what we see, Black and Brown communities are having higher rates of unchecked health conditions. They're also overrepresented in the essential workforce. And so, what does that necessarily look like in terms of being in an essential workforce? That may be healthcare, retail, hospitality, like food services and things like that. Jobs where there's going to likely be a lack of paid sick leave and adequate health insurance. And so we're going to see income disparities and access to medical facilities. These also, of course, can heighten the effect of a crisis like coronavirus. In addition, many of the pre-existing conditions that we see can be tied to poverty and trauma. So what do we know about a pandemic like COVID, where individuals who have pre-existing conditions are likely to experience more severe complications from COVID-19, from the disease? There are three things: worse baseline health, the conditions of our work lives, and access to that care. Essential workers, I want to make a point, here that less than 1 in 5 Black Americans have the ability to work from home and be able to socially distance themselves in order to protect the health and safety of themselves and their families. In fact, they're more likely, along with their Latinx communities, to also disproportionately fill low-wage, no-benefit jobs like grocery store clerks. So I would like to say that as our ACLU National Director of Racial Justice Project, Renika Moore, stated in her blog, these workers still show up because the alternative, unemployment, eviction, and starvation for themselves and their families, is worse than staying home. So we look at some early data that has been coming out of the Midwest and the South. What we see, for example, in Chicago is that even though the Black community only makes up 32% of the city's population, they're being overrepresented in confirmed cases and deaths. 32% of the population, but 42% of the confirmed cases and 56 of the COVID-related deaths, which we can see illustrated on the left hand of the screen. And I think it kind of really just drives, that point home of like who is really being impacted in some of these large cities like Chicago, New Orleans, Detroit. What we have here in Michigan, where the outbreak is kind of really centered in Detroit, Black people make up 14% of the population in that city, but they're representing 40% of the deaths. And in New Orleans, where 70% of the people there have died of COVID-19. And then that Black residents in Milwaukee County, who make up 20% of the county's population, are making up 50% of the COVID cases and 81% of the deaths. 26% of the population, but 81% of the deaths. And I do want to make a particular note about Milwaukee County because it was one of the first stories that were breaking out about the disparities, is that they were one of the first localities to put up this extensive data about racial disparities and how it was affecting the Black community. But it's important to make a note that this wasn't by accident, because 2 years before the pandemic broke out, Milwaukee County declared racism to be a public health crisis. And so this push actually was through public health officials, and that they were already making it a priority among communities to start tracking data, to start addressing the health disparities that were already there and in place. They didn't need a pandemic to tell them that health disparities among communities of color were real and that racist systems were playing a role in health outcomes. It's just unfortunately, COVID-19 just accelerated the urgency to take this matter seriously. So in conclusion, what the COVID-19 pandemic is unveiling is structural racism and the manifestation of how it impacts Black and Brown communities who have been historically oppressed and disinvested, particularly from our healthcare systems. And as you know, we have to kind of say that systemic racism is the root cause of racial health disparities. There is an article in Mother Jones of a former CDC epidemiologist who likes to explain it in this way. If you want to see the ultimate expression of racism, have a healthcare system be so taxed and beyond capacity that rationing decisions on who gets personal protective equipment or ventilators is made based on whether someone has pre-existing conditions and may essentially disqualify them because they're more likely to get seriously ill or die from coronavirus. So I want to ask Representative Harrod that as the stories were coming out of Milwaukee and Detroit and New Orleans and other major cities across the country on how COVID-19 was impacting Black communities, a CPR News article featuring you came out on April 8th, where you asked Colorado to begin releasing its own COVID-19 data based on racial and ethnic demographics. Could you please share with us what led to your call on state public health officials to begin releasing this information, and why do you see data collection being so important to helping us understand how this disease is impacting Black and Brown communities in our state?
Yeah. Well, first, I just want to say thank you so much for setting the stage with that presentation. I think it's so important that we understand that these disparities didn't just come with COVID or pop up overnight. We know the virus does not technically discriminate, but communities are feeling the impacts of the virus very differently. In African American and Latinx communities, particularly, we're feeling it more. And so, I started to think about this because when I heard about COVID, I was terrified, right? My father actually was a respiratory therapist. My brother is an anesthesiologist with the Navy, and my cousin's a cardiologist. So medical folks are in my family, and I am not one. I'm also the one with asthma. And so when I heard about COVID, I thought, oh my gosh, I am in one of these groups that will be more impacted by this virus. I travel a lot as well. In fact, I believe when I heard about it, I was actually not even in the country, right? And I was concerned about how this would impact Colorado if it got here. And of course, it did come. And so in thinking about that, and one particularly myself, and then some of my other friends who have experienced COVID, I thought, you know what? It's not just me as a Black person who has asthma. It's actually very prevalent in our community. And of course, we're not born with it. I wasn't born with it. Many of us are not born with it. It came because of environmental conditions. And so when you compound all of the uh, deadly impacts that the virus has on our community, on our bodies, on our health. And then you layer in the inequities that have happened for generations in our communities, be it economic, healthcare, the redlining, all of that, environmental, all of that comes together to create a really combustible situation for people of color throughout the country and in Colorado. And so I just wanted to start talking about it. So it's actually quite funny. I started to write my newsletter that I write on a daily basis. And I wanted to do the newsletter on racial inequities and COVID. And it was interesting enough, I went to CDPHE's website, the Colorado Department of Public Health and Environment's website, and I couldn't find the data. And I thought, well, that's weird, And then my newsletter was going out, so I was like, well, I'm gonna send it and I'm gonna ask for the state to actually start collecting the data. Well, if you can believe it, the newsletter kind of blew up and folks started calling the next morning about, where is this data? And I had the same question. I asked the governor's office, where is this data? And they didn't have it. And the response was, we're not receiving the information cohesively from the local departments of public health or the hospitals. And it is required. And so we pushed and we said, we will get this data. We will actually get the incomplete data as well. And within a few days, the governor released the initial data on the website and has since been building on that data every day. And so that's kind of how we came to where the data, to asking for the data collection. But I will tell you, legislators of color who are in these positions across the country, everyone from AOC to Ayanna Pressley, myself, and council folks throughout the country have said, where is this racial data and ethnic data as it relates to COVID? And we've just been able to get them. And I will tell you, if we weren't here and you hadn't elected people of color to serve in these positions, I just don't think we'd be responding in the same way.
Thank you for that. And thank you for, being that push in Colorado to begin collecting and asking for that data and having that data released, because with that, I think what we are finding is what our suspicions confirm. And that is, communities of color in Colorado are also being disproportionately affected by COVID-19. So as Representative Harrod was talking about in terms of, the governor began releasing some of this data, and I'm telling you, under a week, I've had to refresh this time and time again because it always kind of keeps changing. But, kind of what we see here is what is happening in Colorado, the same trends that we see across the nation as it relates to communities being impacted disproportionately is playing out in our own backyards. So just to give you a bit of a basis, we have about 5.7 million people here in Colorado, and only a little bit of maybe under 60,000 or so have been tested, and about 12 or close to 1,300 of those tests have been confirmed for COVID-19. And kind of, and I think they release their data 6 p.m. Every day. And so, this is kind of already a little old. They kind of gives you a sense of where we're at. We're looking at a little under 700 deaths. So to be exact, 672 is what I have here. And so when we look at the data, what we can see here is that, for example, here, for our white neighbors, the census say that they represent about 70% of the data, or I'm sorry, 70% of the population. But you see, like, they're kind of hovering here in terms of about, let's see, the cases, about 60% of the actual COVID-19 cases here, and about, it kind of evens out where the population kind of reflects the number of deaths here. It's pretty even that we see here. But then we have to look here at our Hispanic and Latinx communities. And even though the census say they make up, 21.7 or a little under 22% of the population, they're being overrepresented here in the cases here, and kind of leveling out in terms of the deaths. But as we are beginning, and I will show in later slides when we're looking at specific counties and cities, that lopsided deaths versus population really kind of plays out in our Latinx communities. And certainly what we see here at the forefront is that, Black Coloradoans only just make up 4% of our population, but are accounting for close to 7% of the deaths. So just kind of really that double kind of disproportionate impact. And we also see that happening with our Indigenous community as well. And so I think it's really important that, even though, this may seem like it's statistically, communities like, Black and Indigenous communities seems statistically small in Colorado, the impact is real, and the lopsidedness becomes real. We know that the top counties that are seeing the highest rates of infection are Denver, Arapahoe, Adams, Jefferson, and Weld counties. And that, even what we're kind of seeing here is that Latinx residents, who make up about 20% of the population, like we stated before, are accounting for almost a third of the state's COVID-19 cases. And so it's important to kind of put faces to what is happening here at home. Mr. Sergio, this was a story in the Denver Post, and Mr. Sergio Rodriguez was released from the hospital last week after he became so ill with COVID-19 that he was placed on a ventilator. Mr. Rodriguez and his daughter Crystal both work at the JBC meat processing plant in Greeley, which is housed in Weld County, where hundreds of workers have been calling in from work as cases of coronavirus has been spreading throughout the facility. when the post had said that when Mr. Rodriguez went to his doctor, they told him he likely had, the disease, but he couldn't get a test. And so I think this really drives home that, as increased risks to folks of color are becoming more apparent, it's really important that, in order to analyze all the factors, including systemic bias that plays a role in how folks are getting treatment, we need to be expanding testing and getting more data on individual cases. I want to say it's good to note that CDPHE is doing more targeting testing in Will County because of stories of Mr. Rodriguez and what's happening at the JBS meat processing plant are coming to light. If we were to take a snapshot of some of the counties that we discussed, we can kind of see now Tri-County Health Department, they kind of break down, they're doing good in terms of trying to break down not only in the percentage of cases broken down by race or ethnicity, but actually giving a number of how many cases those are, and also beginning to start looking at how many of these cases are linked to health disparities. And so, certainly what we see here is that for our white communities in Arapahoe County, they make up about 38 or 39% of the cases, but they're about 60% of the actual Arapahoe County population. For our Latinx communities, they actually only make up a little under 20% of Arapahoe County residents. But as you can see here, they're making up 34% of COVID-19 cases. And then also, for Black communities, in Arapahoe County, they make up 11% of the population, but are overrepresented in terms of COVID cases, which is sitting right at 18%. And it kind of breaks down when you really kind of understand just how much it impacts when you're looking at how many folks are being impacted per 1,000 folks. And as you see here, about 4 Black individuals per 1,000 people are being affected. That's a really lopsided way when you're talking about Black residents only, making 11% of the population in Arapahoe County. The difference becomes even starker when we're looking at Adams County. And I think what we can definitely see here is that the Latinx population is making up 65% of COVID-19 cases. But they only represent 40% of Adams County residents. And same here, the Black population in Adams County is a little bit under 4%, but they're close to 4.5% in terms of COVID-19 cases here. If we were to look at Denver, we kind of see the same thing here as well. Denver's population is kind of right now hovering a bit over 700,000 people. The median household income of Denverites is about $56,300 per year. But right now, which I'm sure the number has changed a bit, it's a little bit over 3,000 cases in Denver and 164 deaths. Now, the Denver Public Health website doesn't break down kind of some of the demographics that we see as clearly sometimes as, say, the Tri-County Health Department, but we definitely can see here on the right side of the screen what is happening here, where the Hispanic population accounts for 30% of Denver residents, but we're looking here and it's 45% of the cases. And then for, the Black community in Denver, 8% of the population, but definitely where am I at? I'm sorry. But over here representing kind of like 12% of the cases here. So again, seeing that lopsidedness. And if we were to begin to start applying some of the same, kind of the same principles that we talked about earlier on, and begin to start taking a deeper dive into our Denver neighborhoods, you can definitely begin to start seeing how income disparities, and even more particularly some of the major industries that Denver residents are employed in each of these neighborhoods could be playing a role in the rate of cases. So for example, if we were to look at the Gateway Green Valley neighborhood, it is a largely minority community where we have 37% Hispanic and 29% Black. Now, while their median household income is higher than Denver's average, we can see what their top industries people are employed in this neighborhood, healthcare being the highest that folks are employed in. And I think it's, important to note that, as of some of the data that we were seeing, the Green Valley neighborhood had the highest number of cases out of the Denver neighborhoods that we were seeing. If we were to look at Northeast Park Hill, also a largely minority community, which we see here, and this is a neighborhood I grew up in, 43.4% Black, 25.6% Hispanic. The median household income under, below the city's average. And you can see here too that the major industries people are employed in, healthcare, healthcare workers who cannot socially distance or are considered essential workers who have to go into hospitals, have to go into healthcare facilities to take care of folks who are sick and are likely to be more exposed. Hospitality, when we say hospitality, we're talking about restaurants, food service, also another one of those essentials, because as we're staying home from our stay-at-home orders, people still need to eat. And then we also see what's happening in a West Side neighborhood of Valverde. 79.5% of the neighborhood is Hispanic or Latinx, and it has even a lower household income than the Denver average. And we can see here the top industries that people in the neighborhood are employed in is hospitality, construction, retail, some of the very same industries that are deemed essential. And therefore, again, as we said earlier in the webinar, less likely to, be able to work from home, may or may not have access to health insurance. And again, to put a face to these stories, we can look at another story, which I believe that Representative Harrod had noted in the CPR news, is of a recent Denver transplant, Robbie Turman, who thought that the shortness of breath that she was experiencing was just due to trying to acclimate to a higher altitude. But before it wasn't. Her lips began to turn blue, and she was admitted to UC Health, where she spent 10 days on a ventilator and under a coma. It's lucky that Ms. Turman and Mr. Rodriguez are some of the first patients from Colorado to be placed on ventilators and successfully survive COVID-19. But just to show it's impacting folks and real folks on the ground, and that Ms. Turman and Mr. Rodriguez's stories are just many in the state and in the nation of how quickly one's health can take a downturn in this pandemic. And so if we're wanting to talk about how, now that we know what we know and the way in which COVID-19 is impacting Black and Brown communities, what is an equitable response to ensure that these vulnerable communities are getting the equipment and the things that they need to fight this disease. And so, Representative Harrod, I know that soon after Governor Polis had held a press conference, I believe on April 13th, to discuss the CDPHE data that again confirmed that Colorado Black and Brown communities were being disproportionately impacted by coronavirus. A coalition letter was sent out to the governor, which included signatories like yourself and other state legislators, healthcare professionals, and community organizations like the ACLU, the Colorado People's Alliance, COPA, and Black Lives Matter 5280. And in essence, the letter requested assurances that Colorado's response to the COVID-19 crisis would be taken through an equitable lens to address racial and ethnic disparities uncovered by this disease. And so we just wanted to know if you could briefly explain the specific actions requested in that letter and how these actions not only would impact our response to the disease today, but how they could be used in a more holistic approach to address health and economic disparities that communities were already facing before the pandemic.
Yeah, and I want to say thank you for the data and going through how it really impacts us at such a neighborhood level too, right? I think what we have to note, though, is that African Americans and Latinos are also less likely to receive testing and access to healthcare. So usually when these tests happen, they're already in the ICU or the ER. And so these numbers are underrepresented. We also know that in our prison system, we have outbreaks that are not being counted and not being reported. And that is a huge problem, and it disproportionately impacts our communities. But to break down the data really clearly, African Americans are twice as more likely to get coronavirus and die from it in Colorado than our white counterparts, period. Mm-hmm. Period. That is hugely problematic, and it's scary. And so when we called on the governor to release data, and to be fair, the mayor was a part of this as well, the mayor of Denver, and then they shortly thereafter started to release data as well. But we wanted them to collect a report, data by the demographics. Again, this is the coalition letter. To create a statewide hotline for workers to track employers who are not providing PPEs or complying with health and safety guidelines. Let me talk about that for a second. Yes. Because what I think is really important to note is that every night at 8 o'clock, Denver goes out and howls for our essential workers, right? We see all of these commercials of folks doing things for essential workers every single day, but not really overlaying the fact that our essential workers are people of color. And when we ask for a people of color response, right, so that we can protect our employees and our communities, we get backlash. And that's from community, right? And so it's really important that we take this seriously. I mean, you can't applaud us on one hand as essential workers, but as soon as you see our race, shut it down, The reason why we are more likely to contract the virus is because we're still out in the community working every day for our community. That's why it's important that employers are held accountable and that employees can actually report in a safe and anonymous way, and their loved ones can report as well. We also asked for a statewide hotline to report health disparities because we know that that's a part of the system and that continues to happen. So same hotline, same number, 211, super easy. Establish a cash assistance fund for those with an ITIN number. And that's basically Coloradans who are paying taxes every single day, but are being left behind and not eligible for federal resources like unemployment. And then also to create an equity response team. Now, I'm happy to say that the equity response team has been created by the governor. The data is being collected, and we are working really hard on the hotline. There's more that we need to do, but we gotta get the information first so that we know how we can intercede and where we need to stand up for our communities.
Sorry, I had to put myself on mute as a fire truck was going by. I live by a fire station, and you know, the calls are going out constantly, so I even hear it on an audible level what's happening. Thank you for explaining, what exactly, we're asking our government, officials to do in order to continue that push forward. Is there anything in terms of like after this push, how folks, can begin taking action or being more aware in terms of, how things are playing out?
Yeah.
Like,
Exactly. I think that we need to start really stand up for ourselves and our healthcare needs, and demand it, right? Because we know that the system is going to treat us inequitably. I want to be clear that also the blaming of African Americans for our health disparities and Latinx communities for our health disparities is not fair at all. It again comes from these systems and years of oppression that are put on our communities. And so it's really important that we don't vilify people of color when they go seek medical attention, right? And that our laws don't back that discrimination up. So for instance, we cannot take a colorblind approach to the COVID response. We need to be targeted in our response, be it economic, healthcare, environmental, or otherwise, and say that these communities are being impacted differently. We must have a different response. Education. Our kids are being left behind right now. And I'm glad that DPS has stepped up, Denver Public Schools has stepped up and said that we are going to make sure that no kid falls behind in this process and in this pandemic. And I think that's hugely important. And so when it comes to the response, those were what we called for, but even in getting that data, what we're getting right now, it's clear that we need to hold employers accountable. We need to continue to educate our healthcare professionals about medical discrimination. Usually, they don't know that unconscious bias exists. They definitely don't think that they have it. But once you talk about it, they're open to it. I mean, they're like, whoa, okay, I'm here to save lives. I'm here to do the best for our communities, and I give my day in and day out for this. So once they're educated, they're like, yes, I'm there, and they're less likely to be biased in their response in the future. It's super easy, right? And so those are the kind of things that we need to address, not after someone dies, right? But to prevent deaths in our communities today. We also need to make sure that everything that we do is culturally competent. All of our responses are culturally competent. And I would be remiss if I didn't say we need to start depopulating our jails and prisons, because that's where people are catching the virus as well.
Thank you for that. Particularly, I think driving home the point of preventing deaths before they happen, because I think having that system in place is what is going to remain. The pandemic will go, when it goes, but these health disparities will still be here, and so it's important to have those systems already in place to apply in the future for other situations. So with that, we think, hopefully it's helpful, to, talk about like what community may need now in this moment, as they are kind of fighting not only against the disease, but also fighting against systemic disparities. And so I wanted, hopefully to share, a few resources with folks. And certainly we'll be putting this information up on our website, Advocacy at Home, where this video is being recorded and will be put up there. But we also have a list of community resources, so we'll put that up here. So we have, of course, the Center of African American Health. They have a website, a list of external resources to connect with, including information on how to receive temporary rent and utility assistance, emergency special enrollment period for health insurance through Connect for Health Colorado, and webinars on how COVID-19 is impacting the Black community. There's also the Mutual Aid Fund for LGBTQI plus and Black and Indigenous people of color folks. This is like one of the largest national mutual funds that are going on in the nation to help support people who may have lost their job, may not have sick leave, or experiencing food insecurity. So far, they've raised over $230,000, and there's no geographic restrictions to where they're providing aid. And so far, over 900 folks have applied for assistance. We also have the First Nations Development Institute Relief Fund. They're distributing funds to Native nonprofit organizations around the Southwest region of the country. There is a resource here in Colorado called Impact Charitable Undocumented Workers Fund. Unfortunately, you know, our undocumented neighbors are being cut out of the federal aid stimulus brought by the CARES Act and are ineligible for employment insurance, even though many of them pay their taxes. And so hopefully this fund here has helped to provide cash grants to Colorado families that are being shut out of relief programs to assist with food, rent, bills, and so forth. We also have Servicios de la Raza. They have a great page as well of community resources, as well as a program that's helping to deliver grocery and toiletry items to families and seniors at no cost. They've been working in Karma City, Westward, and the Montbello and Globeville neighborhoods in Denver. And then we also have Kaizen Food Rescue that is also working in the Denver metro area. They have if you go on to their website, they actually have a calendar with the dates, times, and location stops they will be in different neighborhoods to help with food. Representative Harrod, I know you have a great page on your website, which we'll also be sharing in the webinar notes for COVID-19 resources people can look into for assistance. Are there any community resources that in particular you would like to mention that you think would be helpful to share?
Yeah, so I just put up my weird virtual background for you all. And if you can see it, that can help you to find information for how to reach out to me. I think it might be backwards. That's interesting. Is it backwards for you?
Yes, it's backwards for you, but not for us.
Oh, okay. Tricky. And so definitely, you know, follow my Facebook, Instagram, Twitter, or sign up for my newsletter. We're putting a lot of community resources out every single day to help with the COVID response. It's anything from what to do when you get sick to how to get assistance on evictions to, you know, what to do with your pets. And so there's all kinds of things on the webpage for that. But what I also will point you to is Caring for Denver. We know that mental health and substance use services is also often underfunded and overlooked, but it's definitely magnified during a pandemic. And so you can go and get access to mental health and substance use services right here in Denver for free, even if you're not in crisis. Caring for Denver just funded, which is an organization that I'm the chair of the foundation and created the foundation. We just funded over $600,000 worth of resources to the Denver community to provide mental health and substance use services. And so please reach out if you need help. It's okay to ask for help. And again, you don't have to be in crisis to get it.
Thank you so much for mentioning that piece. I think sometimes, you know, and we forget about like it's the whole body, whole person approach, even you know, making sure that we're protecting our mental health.
Yeah.
So with that, with closing remarks, I'm hopeful that, you know, this webinar, you know, certainly while it has some very stark and sometimes grim, you know, statistics about what is happening with communities of color when it comes to COVID-19, nevertheless, they're real. But again, that, you know, the way in which this disease is proliferating in communities is really just a physical marker of what has kind of always been there. And that is, again, you know, kind of the de-investment in communities of color when it comes to protecting their health. And so hopefully you come away with this webinar, you know, informed, knowing that, you know, there are folks out there advocating to make sure that we're pushing for more data, more testing, and a more equitable approach in terms of how we treat this virus. And, you know, that there are resources out there if you need help. And, you know, also too, I want to make a note that if you're on this webinar and, you know, you don't identify as a person of color, or if you don't identify as a person who may need help, then one of my, you know, asks is to go to one of the resources listed here, or the resources that Representative Harrod listed on her website, and make a donation. You know, of course, like, these funds, like, don't just like magically kind of, you know, fund itself. It really does take community to kind of make the push to make sure that we're taking care of each other. Representative Harrod, did you have any last remarks?
Sure. I just want to thank you for having me, and thanks to the ACLU for really addressing this issue. It's so very important. And to people who are watching the webinar, absolutely donate to these funds. Also lift up your voice. If you're not a person of color, you might not think that your voice matters in this conversation. It does. We need champions, not just allies. We need champions who will stand up with us and demand an equitable response to the COVID pandemic, and demand that we start addressing these inequalities now. And so thank you all for watching. Thank you so much for having me. You've been a great host, and I've actually really appreciated the data. I took some notes there, and I look forward to working with community to tackle these issues head on.
Well, thank you so much. And I just wanted to put up, like, your information if, again, people want to reach out if they're looking for more information in their area as well. And so before, I guess, you know, we go to any questions, if there are any, again, we just want to thank you for taking the time out to come and to speak with our attendees about, like, what is happening in our state, and how they can be informed and involve themselves. And I guess before we go to questions, I also want to thank Deirdre Brooks, who is our comms associate, for helping us with the presentation slides. And Catherine.
I do have another webinar to jump onto. So
yes.
You have the questions, and reach out to me, anyone, if you have other questions or you'd like to chat more about it. So thanks
Awesome.
so much for having me.
Thank you so much.
Thank you.
Thank you, Representative Harrod. I just wanted to say, if anybody has questions, there is a Q&A box at the bottom of the screen. At least for me, it's at the bottom of the screen. So if you have any questions, go ahead and type them in there. I can't, you know, this was such a thorough webinar. Maybe this first one we won't get questions on, who knows? But any questions, type them in. This was really amazing information. Thank you so much for putting this together for us, Jessica. We really appreciate it. And I have to echo what Jess said. If you can, this is the time to give. This is the time to help our neighbors. So please, if you can, you know, it might not seem like that $25, you know, we're all saving money on Starbucks right now, right? We can't go through that drive-through anymore. I'll turn my video on so I'm not like the voice of God anymore. We can't go through Starbucks every day anymore. We're not going to work anymore. Let's take that money and let's give it to these community organizations that can really help our neighbors. Christina wants to know, what organizations do you suggest giving to? So Jess, what do you suggest?
So again, I think with the organizations that we have here, they're accepting donations in order to then go out in the community and to provide services. So Impact Charitable Fund is definitely one that I would definitely suggest, because again, when it comes to our undocumented workers, they've been shut out of getting a stimulus check. And so that, you know, for me, I think, you know, kind of also drives like the point home of, you know, when we have neighbors who are being shut out of our society, that we make sure that we take care of them. So yeah, no, I think any of these, now the Center for African American Health has like resources, but you go on there and they have more resources and you might be able to find something there that speaks to you. But yeah, any of these community resources that we have up are accepting donations. And so I would suggest giving to all of them.
Yes, definitely. Um, Got another question coming in. Let's see. Do healthcare workers in Colorado have enough PPE? And how can we ensure there is enough PPE for both healthcare workers and other essential workers, including JBS?
Yeah, I mean, I know JBS, they were asked to shut down, and I think at least until April 24th. So I'm not sure if they are still open. And certainly we've been hearing stories about healthcare workers shortage on PPE. Like Representative Harrod, I too also have a family full of healthcare workers, researchers, physical therapists, nurse practitioners, and they're telling me they're not, don't always have the protective health equipment. So I definitely think, what Representative Harris said, as she was talking about the coalition letter and really kind of making that push and making sure that we're really raising our voice. And so if you think that there is an outlet you can talk to, whether maybe it's your local hospital, just really kind of using your voice, raising your voice, and finding a place to make sure that you're advocating for these supplies.
Great. And I just want to give folks another few seconds. Oh, there it is, another question. Is the governor's relief fund adequately addressing the needs of these communities, and are people of color represented enough in the decision-making process of who gets the funds? Ooh, that would have been a great question for Representative Harris.
Yeah, I definitely would say, and I think that she probably would have a lot more information on that. So we'll definitely take your question and forward it to her and see if we can get you a good response, because that is a good question.
Maybe that can be a subject of her next newsletter. We'll pitch it to her. Is anyone coordinating the advocacy on behalf of healthcare workers and people of color in general, so that we know where to go to help?
Are you looking for like kind of like a similar, like a team that is like making that their one issue? That I'm not sure, and we can also take that and see if we can find an answer for you to see if there is one particular organization that is leading those efforts.
And Wendy, we know you very well, so we'll get you that information.
Awesome.
And then we have a thank you, and thank you all for joining us, because this for me has been very enlightening and sad. So as advocates for civil liberties and civil rights, when we see these things, we just want to help. So I know a lot of people are feeling that, and we will have these resources on our website in the next day or so, so that we can all find a way to help.
Awesome. Thank you so much, Delana, for moderating yet another, another webinar.
Another one under our belt.
Does these like twice a week, you guys. So many props to Delana.
Yes, I love doing these. And thank you all for joining us tonight. We are going to go ahead and shut down so you can get back to your evenings. And we thank you all for joining us. Thank you to Jessica for producing yet another great webinar. She is our returning champion, probably having done more webinars than any other person on staff. And we thank Representative Harrod for joining us tonight. On Wednesday at noon, we will be doing a lunch and learn, and this is a repeat of our voting rights webinar. So if the evening time didn't work out for you to tune in for that, we'll be doing it at noon on Wednesday. Information will be forthcoming. You do have to bring your own lunch because we still can't get together, but we're looking forward to when we can all be together in person again very soon. So again, thank you all for joining us. Have a wonderful evening.
Thank you so much.